Untitled Children and Youth Care offers a range of early intervention, secondary and tertiary services to children, young people and families across the metropolitan area, the Murchison and the Wheatbelt region. Our mission is to protect, care, advocate and provide therapeutic services to children, young people and their families who have experienced trauma from abuse, and to provide supports for the community in the effort to prevent child abuse from occurring. Nowhere is this mission more evident than in the work we do in the Armadale area, where we bring together specialist child abuse services, family capacity building, early childhood development and community education services. In 2008, we embarked on a journey to bring low-cost and free psychological services to the area of Armadale and specialist social work services to the local school community. Soon we were inundated and recognised the need for more services in the area to provide families with the supports who just needed a little bit of extra help, and to provide specialist services for children and young people who have experienced trauma from abuse. This culminated in the opening of the George Jones Child Advocacy Centre in March 2011. With this came a multidisciplinary model including integration with multiple agencies and services. The centre is a purpose-built, family-friendly space complete with 2 little dogs. It's a space in the community where families can come, seek support services and feel safe. The centre was designed in collaboration with the local community, right down to the artwork and the mural covering one of the outside walls.
John McTurnan, Detective Sergeant, Child Abuse Squad. WA Police Child Abuse Squad is part of the Multi-Agency Investigation Support Team, or MIST. We have a team of child abuse investigators and specialist child interviewers located at the George Jones Child Advocacy Centre. We co-locate with Child Protection and Family Services, as well as a doctor from the Child Protection Unit at PMH, as well as staff from Parkerville who provide a multitude of services for children and youth. The importance of the co-location is not only to develop effective working relationships, but also to provide support services to victims and their families for child sexual abuse.
My name is Mariano Calzada. I'm a Detective Sergeant with the Child Abuse Squad, and I'm attached to the MIST team here in Armadale. When a family or a victim undergo a fairly traumatic experience, they can come down here and be dealt with by the government departments and counsellors in one location, and minimising the re-traumatising of the person during the process.
On a personal note, I've specialised in child abuse investigation for the last 5 years, so I have an understanding of what the normal procedures and support services are. This model provides the ability to provide a faster collaborative response to child sexual abuse investigation. It provides additional support and services to the victim and their families. On that basis alone, the MIST model is a more effective and efficient response to child sexual and physical abuse.
In the last 5 years, I've been involved in a number of investigations during which we have had to go and revisit victims who are now adults, who were offended against when they were children. Now, the trauma these people have shown when police have approached them a decade or later to try and engage them during the investigation has been enormous. I believe that if there had been earlier intervention, these people might have been able to re-engage with the community, their family, and get their lives back on track and achieve much greater things with their lives.
My name's Gary and I'm a specialist child interviewer and I work for the West Australian Police. My role as an interviewer is to receive the files and review them, make contact with the family and explain the process to them. I also organise that the family are brought in with the children to the centre, and myself and advocate meet the family at the door and bring them into this room, which is the family room. After that we take the child and parent into the interview room where the parent is then asked to leave the room once the child is comfortable. So once the parent leaves the interview room, it's just the interviewer and the child in there. The interview is video recorded, and the advocate sits in the family room and talks the family through any possible services available to them, and also to help them feel comfortable whilst their child's being interviewed. We give the children the opportunity in a child-friendly environment to speak about their experiences in depth. And in my experience, I found that 99% of the children who go through this process feel it's a positive experience once they finish the interview.
Hi, my name is Lisa, and at the George Jones Child Advocacy Centre, my role is a child and family advocate.
Hi, my name is Tina, and I too am a child and family advocate at the George Jones Child Advocacy Centre.
As a part of the advocate role, we provide support in a very stressful situation for families. They come to us in times when there has been a disclosure of child abuse, and that can include bringing in all sorts of services, including police investigations and interviews. It can include safety and wellbeing assessments by child protection agencies, to down the track that might even include a court process.
We understand that sometimes this might be the first time a family would have had contact with all these services and might be overwhelmed because they might not realise what each individual does in their role. So us as advocates, we guide the families through the processes and help them navigate through the system.
An important aspect of the work with which advocates undertake is to include that the children, young people and families are included in the decision-making process. This means that we advocate and we ensure that their voices are heard, their thoughts, their wishes and their hopes are included as part of our multidisciplinary team meetings, at school meetings, and even at times with their extended family.
We can share strategies and information with the families on how abuse can impact on a child and their behaviours. We share this information with the families and make referrals for them to local services to keep them local to their community and offer community response to the families.
The role of the advocate can vary depending on the individual needs of the family. This can mean that we start from the time of interview where we can just sit down, offer a coffee to a family member or a parent or a caregiver, smile at them, share their concerns about their children on the day. It can mean providing information on the forensic process. It can also mean providing education about the impact of trauma on themselves and for their children. Working as part of a multidisciplinary team and in collaboration with other professionals lessens the effects on the family for them having to share their story over and over again. It allows the professionals to share information, better providing for the needs of the families and planning for the interventions that are required to better support them. And it allows better response times, and ultimately it allows for the healing to begin.
Lisa and I are privileged because we can stay with the family for as long as they need. Services may come and go with the family, but we can stay involved for as long as the family needs.
In recent months, the Centre has also become the home of the Multi-Agency Investigation and Support Team. The team is a West Australian first and brings together an integrated working model between government and non-government agencies to respond to cases of child sexual abuse in the Armadale area. The team consists of workers from the Department for Child Protection and Family Support, West Australian Police Child Abuse Squad, Department for Health and Parkerville Children and Youth Care. We are currently partway through a 3-year relationship with the Australian Centre for Child Protection to evaluate the model. A multidisciplinary team approach is crucial to responding to child abuse. We know that the impacts are widespread. They affect not just the child, but the family and the wider community. By bringing these services together around the one table, we can improve service delivery and outcomes for families. At the Centre, we have professionals from police, health, child protection, advocacy and therapeutic services, all working together for the best outcomes for the family.
Hi, my name is Jamie and I'm a clinical psychologist registrar based at the George Jones Child Advocacy Centre. The psychologist role I take on at the Child Advocacy Centre involves providing psychological support to children, young people, adults and families who have impacted trauma caused from abuse. Therapeutic intervention is targeted specifically at treating the pervasive symptoms of complex trauma, which is what we often see in our clients. Our practice involves clinical assessment, treatment planning and implementation. It's specialised and it draws upon leading evidence-based approaches in treating trauma in children. We treat each client and family on an individual basis. We sit down with them, we get to know them, we get a really good understanding of how best we can meet their needs and then come up with a plan for therapy. We're in a unique position where we can work really closely with other services available to the families that we see. These services include the Department for Child Protection and Family Support, the Child and Family Advocate, the West Australian Police and the Armadale Family Support Network. Working as a part of a team allows us to work collaboratively in providing our clients with the best possible support and access to all the services that are available to them in their community.
My name's Vicky Smith. I'm Alliance Manager at the Armadale Family Support Network. Armadale Family Support Network is a network of over 18 community services supporting children, families and young people in our local area. Our aim is to support families to ensure that they don't have to tell their story to lots of different services, and through our thorough assessment process we can identify with families what services they need and link them in as quick and easily as possible. We only share information when our families consent us to link into those services, and all of the interventions are client-led. The services that are linked into the Family Support Network are varied. These services include parenting, mental health services, individual counselling and domestic violence services. There's lots of other services that we do offer, and we can either link you in directly through the network or to services that are outside of our network. If families would like to link into the Armadale Family Support Network, they can contact us by ringing our 1300 number, that's 1300 887 487, or our families can walk into our George Jones Child Advocacy Centre and ask to speak to one of the workers here.
Parkerville Children and Youth Care is committed to providing specialist services to children, young people and families who have experienced trauma from abuse, in the hopes that we can support them to have a brighter future. But we realise that if we support families in the early stages, if we can provide targeted and universal services to the community, if we can build awareness on issues such as child development, abuse and personal safety, we can help prevent many families from having to experience the harmful impacts of trauma.